Yeah, I bet I learned to show consideration.
Let's just go around, quick introduction. So, Amanda, you are the founder of Atlas School of Autism.
Yeah, the Atlas Foundation for Autism, yep.
Foundation, meaning there's more than school?
We run after-school programs. We have free community programs every other Saturday. We do camps throughout the summer, private tutoring, speech and OT.
Right.
And we also try to support other organizations in the community, as well as running a full-time school for kids 7 to 21.
And Dr. Ali?
I'm an autism parenting strategist.
What does that mean?
It means I help parents learn how to navigate autism.
Do you get flack for doing that sometimes? Because that must be a dangerous job.
No,
No.
I've never received any flack. I had a book. My book came out first. It speaks about Amazing Gift. And
What's the name of your book?
It's Amazing Gift, a journey to autism acceptance. So that pretty much introduced my platform into what I do. It spoke about my going from total denial, total guilt, anger, everything that's associated with wanting something perfect and realizing that there is no such thing as perfect.
Right.
And now helping parents to go through that process, like pulling them out and letting them know it's okay. It's okay to be angry also. It's okay to feel denial.
Sure.
It's okay to go through what you're going through.
Right.
Just don't stay there.
Jennifer, I know a little about you, but you're Italian. You are a New Yorker, or somewhat of a New Yorker. You haven't, and you seem like a kind of like a badass girl as well. In addition to Amanda, is this correct?
So I'm a New Yorker. I'm a nonprofit consultant, and I work at Atlas.
Right.
We are a nonprofit, so we have a school and a foundation.
Right.
And I'm a parent of a 19-year-old with autism.
And Oscar.
My main job, I'm a paid greeter at Shake Shack 16 hours a week, so I give out the menus, the samples, and the drink refills. I also make dog biscuits for Invictus. For an autism program, I do volunteer work at Atlas in the New York Metro chapter. And with Shake Shack, the third Friday of each month, we make peanut butter and jelly sandwiches for City Harvest. And I do fundraising gigs for benefits for agencies. Those are my evening jobs. And fairs. And I do stuff for Best Buddies too, actually. Like,
What's Best Buddies?
they match up with the buddies, like a big brother, big sister, actually.
Right.
My buddy is Alessandra. She's a speech pathologist.
Do you have any hobbies?
I take walks and listen to classical music and jazz.
No other music, right?
No other music.
No, just classical and jazz.
Yeah.
Right. And do you feel like sometimes maybe you might be missing out? You try a little rock and roll from time to time?
Time to time, but not often.
Not often, okay. And Bob, a little bit about yourself?
Yes, I'm Robert Tester. I have been
Do we go Robert or Bob?
either one.
Okay.
I have been an academic tutor for the last 10 years. I got my start there at St. Francis College after I graduated.
Right.
I have a BA in history and a master's in American history. But I've gotten involved with special needs children from my own family. My own child is a special needs kid. And I've worked with children with cognitive learning problems, autism. I've had children with ADHD, not just children. I've worked with college students, high school students, for the last 10 years.
Right.
So the last 10 years have been pretty busy.
But why
BA
specifically are you good at what you're doing? Because there were two things that we mentioned.
Well, the first-
one of them is I think
Right.
you're patient,
Right.
right? And the other is
I care. It was very important to me when I was doing my student teaching. When I went there, I was working with normal children.
right.
And I say normal children. Well, children didn't have special needs.
Right.
And they really didn't need any help. And out in the principal's office overlooked the schoolyard, and there were these two huge red trailers in the schoolyard. And I said, "What's there?" And she said to me, "Oh, that's the special needs students."
Right.
And I said, "Well, Monday I want to be there." And I met a student by the name of Muhammad, who they had said to me, "Oh, he's never going to learn anything. He's just not, he's just not with it." And they would just shove him in the corner, and that kind of became my project. And when I left him in tears, which really bothered me. But he had figured out how to do math and was reading when I left.
April is Autism Awareness Month, and that was started an organization called Autism Speaks. Is that correct?
Yes.
Right. It started, what, back in how long ago?
It's got to be about 10 years ago at least now, yeah.
Right. Has that, and I didn't know this, but April 2nd is Autism Awareness
World,
Day,
yeah.
right? Has this actually created any awareness?
I think it has, and it opened up the doors for this new movement of saying awareness is one thing, deciding what the rationale behind looking for cures, definitions of, or services and support for has kind of snowballed into awareness and acceptance now, and looking at how does the community have to now start to hold space and recognize what we need.
I've become more aware of this world now, doing the show, meeting you.
Right.
Articulate to me something that you feel people are more in tune with this world of autism.
I think letting go of stigma, understanding people have different ways of communicating. You don't necessarily need sustained eye contact to have a great conversation. The workplace.
When you're at a party,
yeah,
and you go and you talk to people,
right,
and you tell them what you do, what's their reaction? Is there
oh
interest?
my gosh! Well, it's always an interesting thing. So many people say, "Oh, God, God bless you." You have this sympathy piece, and I say, "Oh, well, you know what? Maybe if we're dealing with the insurance companies, maybe if we're dealing with paperwork, maybe if we're dealing with a lack of understanding or empathy when we're out in the community, right? But the work with the kids is incredible and sustaining and invigorating. So when people kind of have this lamenting, oh my God, you must be such a saint, it's like, you know what, not so much. Let's be real. I do what I do because I love it, and I get fed from it.
I think you are a saint, though.
Oh, God bless you too. I appreciate that.
I just want to talk about the spectrum, right? So because I was supposed to have somebody on the show, and she heard I was doing the show. She goes, oh, I got good insights on it. I thought maybe she might have had, a relative or something. She said she's autistic.
Oh, wow.
I had no idea.
Yeah.
Right? You have people like her who hadn't the foggiest idea, and then you have very severe cases.
Well, and what that even is defined as is so different. What people think of as high functioning or lower functioning. In our school, we like to say less challenged or more challenged because do you look at language as the main determiner of if you're impacted? Do you look at, people in general, right? If you look at someone who has a low fuse and gets angry really quickly or gets aggressive, is that the main thing?
I'm starting to get the idea sometimes that on some level, we all have
We do. That is so true.
Yes.
Because I was thinking about
so true.
Because again, I'm going into this world now, and it's all new for me. So this is fascinating for me, right?
Right.
I got a friend of mine that I was raised with, good friends, and there was some words he just couldn't get past.
Right.
And I noticed that is a common symptom of autism, sometimes pronunciation.
It's not the autism. Like you have a lot of comorbid diagnoses, right? The autism is really it comes of the definition of and the origin of the word even is of the self and a difference of the self, right? So it's a question of coming out of a world or being in the community, being safe with your sensory systems, right? But the language piece, that's apraxia or that's a processing delay. It's not necessarily the core element of like the autism itself.
That's partially how autism shows up. That's the visibility of how you may see it.
As I learn more about autism, not only the fact that I have sometimes it's tough for me to focus, right? ADHD, you want to call it that. I think it's an advertising term.
Self-included.
Or sometimes I slur my words once in a while, So I'm trying to make the determination: is that autism, or is that stress wreaking havoc on the body?
The reason the only person that can pretty much diagnose autism would be a psychologist. It's a battery of testing that they're doing.
They don't take blood tests.
No,
There's
not blood
no
tests.
And there are no
out of that.
tests, which we're going to get to in a minute, because I do have my feelings on that. They have to go through a psychiatrist or psychologist.
To be formally diagnosed, you have to have, some people will say, I see things, and I have a combination of language, or you may see the physical attributes that they may show in terms of secondary characteristics. But when you see a group of things together, that's what heightens the, is this going on? Is something's more than meets the eye?
Sure.
And then you take them in to get a formal diagnosis of what it looks like, or if it is.
Considering there's a lot of stigmas in society and the spectrum is so vast, right? When we see someone who's been diagnosed as autistic but shows no visible signs of autism, could it be a misdiagnosis?
Well, there are people that lose the diagnosis too.
They do.
Yes.
See, that's fascinating to me.
Yeah.
And how does that happen?
There's a physician that's followed them, and they remove the diagnosis.
Right.
Because they're taught strategies of how to compensate and how to not have the language delay as much. Or
Right.
they may learn how not to flicker. They may use, instead of the secondary characteristics that you may see, they're taught strategies of what not, or what they can do instead.
Right.
So when they test them, it's not, they at their point in time, they've taught them how to do eye contact, so that's
Right.
no longer checked, you know?
There's this kid, Jake Barnett. You guys are familiar with this?
Not offhand.
This kid was amazing. So he's got autism. I saw him on 60 Minutes. He went into high school when he was 8.
Well,
Graduated college when he was like 11 or 12. He's some
Right.
kind of math science whiz.
Okay.
He's along the lines of like
Like a
Stephen
savant.
Hawking.
Savant.
yeah.
You know, and when you hear this guy talk, you don't get any kind of, aside from him being a little quirky,
I mean, do you get a kick out of it?
Yeah.
Right.
you know, you really don't get any kind of feeling that he's autistic.
You're very proud of your autism.
That, I believe, is the reason why I am in college and I am so successful.
Right. Well, you know, if you look at depression or anxiety or certain even immune disorders that people may have, and they learn how to cope and exist and work through some of these challenges, it's not necessarily always going to be visible on the outside to other people, but it is something internal that they know that they're struggling with or that they're investing a lot of attention on. And so they may be putting a tremendous amount of work into that coping and getting through the day, and then going home and stimming out for like an hour or finding another reprieve to be able to kind of have coped with that, or given themselves some cheat sheets to be able to maneuver through. But there's always, it's about that internal amount of work that they're doing.
Did you ever have kids in your school that were mildly autistic and then they had to pull the label back and take it away?
Well, I've had colleagues of mine actually who work within the field who had a diagnosis, had an IEP all throughout middle school and high school, and when they realized that their college opportunities were possibly going to be limited by the label, they actually worked really hard with a bunch of different therapists to be able to kind of navigate and lose that diagnosis, and moved on to actually start their own program. And although they still define themselves as autistic in their own self-identity, they formally, within the context of their label and their medical history, got rid of the label to be able to move forward without a stigma.
And that's the thing. It's been such a negative thing with autism, and no one wants to be autistic. So some people are looking, I shouldn't say no one, but there are individuals out there that may not want to hold the title of being autistic. And there's some that wear it proudly, like
Yes.
this is what I am, and this
Yes.
is what I'm standing up for. But when you have a society where they've labeled it as something so negative,
Right.
it's something you don't want to be. It's like,
Right.
I don't want to be that negative thing.
Right.
I want to get out of that negative thing. So teach me whatever I can do so I could not be this negative thing. So we're trying to shift that conversation from it being so negative.
Right.
When you said psychologists, because I noticed they do multiplication tables. That's big in your world, right? Or not?
I don't know. I think that's like saying, do you know Joe from New York City? You know, I don't think that the mathematics is something that necessarily fits always within the scope of autism, because there are so many different types of ways that it presents. You might have somebody who really is a poet or really a beautiful artist, and the way their autism presents is
depends on the
just
spectrum.
in the way they perceive their senses and what's going on in their environment.
Oscar, as you hear this play out, do you want to add anything?
Yeah, about what?
Just generally what we were talking about.
So there's psychology, I'll tell the difference.
Go ahead.
Psychologists do behavior like a clinician, and psychiatrists does meds.
It's true. What do you think that does in the world for people with autism, or for you with your autism?
It helps me when I need something, when I'm having a bad day, for example.
Right.
And I tell them how I feel. If I need new medication, a psychiatrist and psychologist for autism.
Right. That's great.
So you basically if you feel like you need more medication, you tell them and they give you more medication?
Yeah, psychiatrists.
But shouldn't that be deemed by a professional?
It is. It's decided
so-
on. He brings that information in his therapy discussions, or whomever brings it to the table, talks with the family, the team of people working together, and they make a decision on how that kind of comes together. Not self-adjustment, but going through the professionals.
Which is a beautiful thing. I think it's lovely that he can advocate for himself and say whether I need more or back down, this is too much.
Right.
So I want to commend you for that.
Or I need something different.
Or
Yeah.
I need something different. So awesome.
When you look at a graph and you look at these spikes in autism,
Right.
all right, and they went from here to all the way up through the roof. But I think you said something where, or maybe it was you or somebody else, or maybe it was Jennifer. They're not saying that there's been spikes in autism. It's just that years ago, many people were just not diagnosed as having autism. So in my cynical mind, I think that's the medical society trying to suppress autism going through the roof.
Right.
I saw this graph here. So in 1975, 1 in 5,000. 85, 1 in 2,500.
Right.
95, 1 in 500. So anyway, and
Now
recently,
they say 1 in 68.
Yeah.
so now it went even higher. So it was 2014, it was 1 in 88.
Right.
And now you're telling me now it's 1 in...
The most current
68.
CDC kind of results are saying 1 in 68.
1 in 68. So this thing keeps on going through the roof, and whoever the powers that be are, they're telling us that, oh, you know what, it's not a big deal because we just didn't diagnose people when they were autistic back in the day.
Right.
I just wanted to point out, according to these rates, you know, the way things are climbing, just thinking ahead, this is just my estimation, in 20 years from now, maybe every new child, according to what we see with these rates, every new child will be born autistic, and in 120 years from now, Oscar won't be, he'll be like everybody else. So the question is, two questions, how much does the environment play a role in this? And how much do vaccines play a role in this?
Right.
So I'm the most cynical prick around, so I'm always thinking something's going on that we don't know about. Then there's like all these fights going on, the anti-vaccine people versus pro-vaccine people.
Right.
I was watching a woman, I think, Jennifer, we discussed this, Wendy Chung. Oh, no, did I discuss it with Bob?
We discussed it.
Wendy Chung, so she's like this doctor. I looked her up a bit. She's Wikipedia. She's listed as one of the best doctors in New York
Never heard of her.
Magazine,
Right.
Columbia University, so she seems like she's got a whole list of credentials.
Okay.
But it's funny, I was watching her, and she just, I just felt like the whole thing at some point was like she was there to
Push vaccines.
push against the fact that it's not vaccines.
Right. There's a lot of people pushing against that.
So basically, all you guys being in this world, you agree that there might be something with vaccines? In other words, Jenny McCarthy's not off the rails when she comes out and says...
So I think they need to wake up and stop hurting our kids.
I think that there's so many individual cases, and I think there's so many different elements of autism, and you've got classic autism.
But in a general way.
But in the most simplified way,
Yeah.
here's what I think. I think that it wakes the lion in certain children. I think that if you have an underlying predisposition to autism,
Right.
and your child's system is already high in mercury, or your child had a high fever, or got pushed too many vaccines at once, what happens in some cases is that the symptomology of that autism is so much more exaggerated, and all of a sudden what might have been that quirkiness you were talking about has exploded into full-on autistic symptomology. And that's when you see people with incontinence, that's when you see people with aggression, that's when you see more of the heartbreaking challenges of autism that maybe wouldn't have been so intense had they not been inundated at that point.
If you take the big picture and you see these rates spiking through the roof,
Right.
And then you look at the CDC, okay? The CDC's got a ton of vaccines that they hold patents for.
Right.
So it seems like the CDC is not there to inform us. The CDC is not just there to inform us, they're there to make money too. So
they're
how
often-
well can we trust the CDC?
Well, they often
That's a good
come
question.
from pharmaceutical companies.
Right.
So
Right.
they're in and out. So they work for the pharmaceutical company, then come back to the CDC.
Right.
So there's an inherent conflict of interest going
Right.
back and forth and
Right.
back and forth and back and forth.
According to Robert Kennedy, CDC owns 20 patents and that they're an offshoot of Big Pharma.
They are.
Yeah.
And I'm sure there's going to be somebody watching this who is pro-vaccine, and they're going to say, wow, these fuckers are spreading bad information.
They've been saying that for years, though,
Right.
and it continues on.
Is there going to be some kind of justice with this? Because here's the I'm not saying that, I don't know. I don't
There's
know
a
if it's
vaccine
vaccine. In
court.
other words, I didn't go out and take tests. I'm not a scientist, I'm not a doctor, I don't know, and you guys haven't either. However, though, I get the sense that there's a strong suppression.
It doesn't have as much power as it used to, though.
We can't say that it's not, because there hasn't been that many tests. I mean, we discussed, you mentioned Andrew Wade.
Wakefield.
Wakefield. So this guy, he took one test and he came out and he said vaccines are tied in with autism, and they yanked his license. They took it out of the journal and they yanked his license. Seems a little harsh, doesn't it?
Yeah, and a lot of doctors are getting a lot of pressure.
It's a business.
Right.
It's all a business.
Politics
all
and
business.
business.
And the
Politics
drug
business.
lobby is one of the most powerful
Yep.
lobbies.
Right.
So it's a business.
Bob, good.
I think one of the most important things to look at when I was doing my degree, and we were taking courses and then going out and trying to teach, the labels or the things that they used, say, 30 years ago or 40 years ago have changed. And so, say maybe 35 years ago, 30 years ago, there was no such real thing in schools as special needs children. And there was a greater move toward when they came out with No Child Left Behind, where then they started to survey and start doing studies about where children were at learning and what were some of the learning difficulties and some of the learning problems. Prior to that, that wasn't a focus. So the focus then turned, what's wrong with, why can't every child learn in such a way? They got away from the idea of teaching in the mass and started to focus on what the difficulties were with individual children.
Right, real quick, Oscar, you okay?
Yeah.
Okay, you're listening, right?
Yeah, I'm
okay,
listening.
Good. So you have anything to say?
About what?
About what Bob was
Maybe
saying.
how do people get like autism?
People
Or-
get autism, they tell people they feel like I've had autism issues. Like when I was little, when I used to get out of a cab, I used to slug the person getting in the cab.
Yeah. What do you think got you better?
I let the people get in the next cab. And also,
You're the best, Oscar.
I met with you, Amanda, as well, besides telling me, I told you the same issue that happened on the school bus back in '04.
Yeah, I think we'll get to it.
We'll get to that in a minute. Back to Wendy Chung. So just a couple things. At one point she said, quote unquote, there was no credible evidence.
There is no credible evidence.
And she's just punching everything up at certain key moments.
But let me be very clear. Vaccines do not cause autism.
At one point, you heard the audience applauding, and then they captured a different shot of her from behind, and you could still hear the audience applauding, but then when I looked at the audience, there was nobody applauding. So
There's a lot of fear mongering and a lot of desire to
so
shift.
I'm
it was
thinking to
just
myself, wow,
typed
did they
in.
go into now again, Wendy Chung? I don't know. I'm just saying what I saw, right?
Right.
I've
And-
never heard of Wendy Chung.
Dr. Wendy Chung.
Honestly, I mean, I go
I'll
to
send
one
you
of,
the- I'll send you the link.
No, I mean, I go to I've been in the hospital business. I go to one of the best pediatric practices. I know the pediatric. I've never heard of her.
Right,
I
so
mean,
you
I
make a
no
good point.
offense,
Why is
but,
she doing a TED
I
Talk?
don't know who she is.
Right. So why is she doing a TED Talk?
I have no idea.
Discussing autism. I mean, that's a good point to bring up,
She's
right?
a pediatrician, right?
She is. I don't remember, but she did this whole thing on autism, and
I
she
don't know who she
basically
is.
it just seemed to me.
It seems like propaganda.
And the other weird thing is that they got something I didn't know they called the vaccine court,
and you know why they have that?
which is
Because-
absurd because it just seems like a private arbitration system. So they don't take it to real courts.
And they limit
so they
the
can be
rewards.
balanced, and they can limit the rewards.
The
yeah.
awards.
Right.
Yes.
Yeah, so
And there is vaccine damage that goes beyond the scope of just autism, and there's seizure disorders, and there are a lot of different kind of motor planning systems, neurological issues that people have found that there was no other kind of trigger than the timing of those vaccinations. And I think one thing that happens is people fall into this decisive, everything has to be a black and white, A or B column, right? And looking at vaccinations, it's not, oh, should we vaccinate our children? Should we have these things at all? Of course we want to be healthy from these different things. And you can be for safety measures and for an organized vaccination system that's catering to the sensitive, not all at once.
And so on top of each other.
When I was a kid, we didn't get 50 million vaccines, and everybody gets vaccinated.
No, because you got sick and your body learned how to be able to fight, and your immune system was so much stronger.
So we don't need vaccines.
Well, I think that's a bit. You can say that. I'm not going to.
But we need them in balance and in time. Like, don't. When I look back at Zachary's immunization, my son, and I look at his records, and I'm saying, oh my God! And of course, hindsight is the best sight. They gave him so many, and so at like 4 at one time and 2 at one time. And as a mom,
do you suspect that your son got it from vaccines?
I don't think he got it from anything. What I do believe is that
he got it from something.
Well, I do believe every child.
Whether
and
it's
every
genes
system,
or vaccine, he got it from something.
Meaning I don't believe he got it from vaccines only. What I do believe is that some children are more predisposed, where if there's too much toxicity in their system at a time, then you're going to see it evolve and show in different ways. And when I looked back at the immunization records and I'm seeing all of these check upon check up, I'm like, this is way too much for anyone. Imagine a little being. Now, one child may receive 35 and totally no response because their system is just developed that way. My child may not have. Am I going to sit there and say they're the purpose? No, I'm not going to say that. But what I do know, if I did have a second child, I was going to be more aware of how I decide which vaccines are needed and when it's going to be administered.
And you have to ask, as a new parent, now they're blending the vaccines, not even into separate needles, so there's so many different ones, but they're powerhousing them. So you might look and think, oh, my child just got two needles, they got two vaccines, but now that's a blend of 5 or 6 or 12 different ones, all in one thing. So to be able to space it out, what they can do is make measures and wait it out, say, okay, I just got these vaccines, let me see what my kid's mercury level is, this level is, how is he handling that?
First, like before
in general, I'm a person against big pharma is just a disgusting industry because everything is based on a treatment, not a cure. There was a story once where they went down, they did a, what was it called? I can't remember, but they found something in a fruit that works better than chemo on cancer. And they went down there, they set up shop, and then at some point they were trying to extract what's in that fruit so they could put it into a drug because they can't make money off fruit.
What about medical marijuana?
And
you can't ignore that in this dialogue.
Millions of dollars later, months later, they realized that they couldn't find what was in that fruit and extract it, and they picked up shop and they went back, but they didn't tell anyone. And again, I don't know. Again, I don't know. None of us know. Oscar, but just pull back just a bit. We don't know exactly. You know, we haven't done tests, but the cynical part of me says, why don't we do tests? Why don't we do more and more tests?
Because it's a business.
Because it's a business.
Because it's a business.
And speaking of the business, vaccines bring in $30 billion a year, every day, and they say that's going to spike to $100 billion by 2025.
Well,
so who's going to turn their back on $100 billion?
And that if you send your kid to a public school, you're mandated in most areas. You have to do it. If you're in a private school, you can usually get around it through religious exemption and.
But they're harder with the religious exemptions now. They're making it more difficult.
Depending upon the state you're in.
So what's the argument? Because there was also the movie, by the way. There was a movie done on vaccine.
Vaxxed with, De Niro was a big proponent
so
of that.
De Niro
Wakefield
has personal ties to that. Because his kids are autistic, or one of them. One. They pulled the movie. So then,
but the community is pulling together and spreading like wildfire to be able to make it get out there.
If De Niro, which I think he does, because I've heard him talk subsequently about this, after this whole brouhaha about the movie, why? I mean, he asked the question. He's like, well, why should we not have a conversation about it?
Yep.
You know, in other words, that's the key. But then on the flip side, him pulling the movie, because it rests on him. He didn't have to pull the movie.
It wasn't only his choice, it was the directors of the festival itself. And he went to go and fight to make sure there were private...
They own the festival, so
but
they can do
he
what they
made
want.
sure to help and make sure that the movie itself was actually shared out after it was pulled from the festival, which wasn't his only decision, and made a public statement saying he wanted to make sure that it was given
I got
a fair...
the sense that he might have felt like he made an error in pulling the movie, so then after that he went on to do this whole promo thing to spread awareness for it?
You know what? Walk in someone's shoes.
I don't know if that's the truth.
You know what I mean? And I think he had an awakening. And again, I don't know Mr. De Niro myself, but I think that from what I've heard and what I could just even imagine is once somebody is awake to the possibility of these things, they're going to sit there and say, what's bigger than me is at the very least letting people decide for themselves. And I think that when you get into this other arena too, and you look at the autistic community and what is their view on it, you know, you want to make sure that you're also not saying, oh, we need a cure for this thing or we need to avoid this thing, because there is a value to the autism and to the definition that people have with their relationship with autism. And I think it's important in this dialogue to be able to include that piece.
I just think that we need as much conversation as possible.
Absolutely. Oh, and thank you for facilitating that. That's what we're doing here today.
I think this is one of the main focuses that I want to focus on, because I just, I think we've all been in situations where in business or personal, somebody might say, I don't want to discuss it. End the story.
Yeah,
right?
because they don't want their business get yanked or people stop supporting them.
So when somebody says, I don't want to discuss it, automatically...
You want to dig deeper.
No, it's a sense of control. It's a sense of control on their part, saying, I'm going to control the conversation, I'm going to control what's said about the conversation.
Right.
Anything else you want to add on vaccines? Yes.
You know, every DOE school now has to have a vaccine. It's new. It used to not be that way. So I now get my vaccine, my flu shot. I go to my pharmacy to do that because they know me. I don't do it at my doctor. I get it all done at the pharmacy.
You get flu shots every year?
Yep.
Yeah, do they help?
Yep, usually in September.
Do you get the flu?
I don't.
You don't? Because I know people who get flu shots and you still get the flu.
I won't take a flu shot. I don't want to put something in my system that I think is going to create it.
If you're over 60, there's a shingle shot, actually. My father...
Start all over again. One more time.
When you're over, if you're 60, you could get a shingle shot.
That's true. But it should be people's choice, right?
And my father's had it and went
in his eye. Well, it is a choice with the flu shot.
Yeah.
My father's had shingles, and it went in his eye, which that was dangerous.
That's true. I'm glad he's okay.
We were supposed to go to a friend's, he was supposed to come with us to a friend's graduation at Yale, and he ended up not going because the doctor told him not to. My mother, Vivian Ducat, and I ended up going to the graduation. He could not go because of shingles, and it's dangerous. It's really not
It can be very contagious.
Hey, Oscar, why do you take the flu shots? Did somebody tell you to take them?
I just do. I've been doing this for a while.
Somebody must have, in other words...
So that it prevents from getting the flu, you know.
Did your doctor tell you?
Yeah, my doctor did.
Your doctor told you?
Yes.
Were there years when you didn't take the flu shot?
No, I've always taken it.
You mean since you were a little boy?
Yes.
Oh, I see, okay.
Many parents are not aware. They're not aware of toxicity.
Of what a flu shot can do?
They hear what you should do, and everyone says this is what I'm supposed to do, and I'm the same one. I said I'm supposed to get my child vaccinated, so this is what I'm going to do because this is what parents know, and this is what's being shown and on television, and you're going to the doctor and at schools, get your flu shot, get your this shot.
It is such an industry.
It's like everyone's saying.
You can't go into a CVS without the paper cutouts, right, saying don't forget your flu shot, and you go and you literally walk down the aisles, and they literally have reminders. You go to get your Campbell's soup or whatever, and it's like, oh, and don't forget to go to the pharmacy and get your flu shot.
And not that I'm saying it's right or it's wrong. I'm just saying have more information.
Yes.
That's what the key is. I think we're not educated. We're not. And I shouldn't say educated, but we're not trying to find out more information about something before we put it into our system.
Yes.
Right.
And now we're just putting things into our system. I'm sorry.
I just want to add something here.
Sure.
One of the things that when my son was born with minor case of cerebral palsy, but from that came a lot of other problems, like that as he was growing out, like 6, 7, 8 years old. So on a trip to a pediatrician, the pediatrician said, well, you know, what's his diet like? You know, what, you know. So what I learned from that is that everything that a child eats, and as an educator, as a tutor, you sit there, you're trying to work with the kid and try to figure out what it is that you need to do. You're also fighting a whole load of chemicals that the child takes in.
Sure.
So, for example, one time I was working in an after-school program, and one of the kids had a birthday, and by the time these children got to like 3 o'clock, it was like they were on high-octane gasoline.
Right.
And what you get is well, what did they eat? Well, they had cupcakes and they had soda, and all of these things have some chemical reactions in them. And then on top of that, if you have a child, like I'm working with kids that have all sorts of litany of learning problems, and I have to figure out like what it is that I need to do to get them to the next point. In the meantime, I'm fighting a whole entire chemical imbalance.
And that's the word there,
you have no
imbalance.
clue as to what it is that those imbalances are, because you're just dealing with what you have.
Wendy Chung, back to your favorite person, Dr. Wendy Chung, she just kept on stressing that it is from genes.
Maybe at its most base level, that could be a component of all of it, right? You can't necessarily just create something within the system that wasn't necessarily there. Inherited. So you've got this base genetic predisposition, as Dr. Ali had earlier said, and then you've got this plethora of kind of things coming at them. You've got the food and the diet. You've got possibly the inundation of vaccinations. Some children end up with pandas, which is strep that kind of
What do you mean end up with pandas?
What pandas is a acronym. I forget the full breakdown of it, but there's when strep throat dislodges, it can go and inflame the brain, or it can go and inflame the gut. And after the strep has left the system, oftentimes people see symptomology in their kids of ADHD, of obsessive tendencies, of other physical kind of manifestations. And then you've got, let's say, even within the neurotypical population right now of millennials, you've got this technology addiction where people have not necessarily been taught in kindergarten. They haven't played. They were doing academics and testing before they knew how to jump into a mud puddle. You've got a lack of communication being taught, a loss of home economics, of life skills, and these different things are really cutting a generation off at the knees in the fact that they don't necessarily have the opportunity to explore in play, in conversation, and in social skills, which now this population already has the physiological challenges, and then you add in on society that nobody knows how to have a dinner conversation without making it a big deal if you put your phone down for 5 minutes. And that has impact on society. It really has impact on what opportunities there are to model for our community.
Well, with the genes thing, I also wonder, just again from a layman's perspective, what did the parents do? What did the parents do? Did they take drugs? Did they alter?
I don't think there's any correlation with that in autism. I really don't.
I would throw in that my son works with he's in a social group, and so I was talking with the child psychiatrist that runs it, and she and I were having lunch, and she said, she definitely thinks it's the epigenetics, so that something turns on something with these kids. And so for my son, we had gluten testing years and years ago, never came up with anything. He was tested a few years ago with this very sophisticated test at Duke, and the doctor said, he has a gluten gene, and not only does he have the gene, but it's been turned on. Like, it was that sophisticated, the testing. So if they can do that sort of testing, there's got to be some truth to this epigenetics.
Right.
And I don't believe it really has a lot to do with the parents' genetics. Maybe it does. I mean, my husband and I really didn't, that we know of, have any.
How do you base that claim, though? In other words, have you done enough research to know that conclusively?
I mean, we both had genetic testing.
Right. That's your personal story. In other words,
but that's a lot of the story. I mean, I think that if you go and you look at the statistics.
I can only talk about my story.
Right.
I mean, I can't talk about
anyone else's. And again, I'm playing devil's advocate. I mean, we have to a certain
You're poking the bear a little bit, but sometimes the bear pokes back.
But the bear has every right to poke back. Right. But, it definitely is a combination of things.
Oh,
but
I think it is.
my cynical side says that, as with anything, when particularly as it deals with big pharma, environment and
Right.
vaccines,
Right.
Aerosol cans.
Right. Even the food that
food.
our animals are eating, and
That's
and,
right,
and
all
that-
that stuff.
I think that's one of the things that you were trying to kind of get at as well before, and I thought that was a really interesting
Go ahead,
point.
finish up, Ellie.
No, I was just saying toxicity. I mean,
Right.
you're nailing it. It's in our environment. It's what we put into our body. What we put into our body includes vaccine. What we put into our body includes nutrition. What we put into our body includes the air we breathe and what we are susceptible to.
Right.
So some children can respond to being in a room and would cough. Another person will walk in here and would feel or sense lint at the back of their throat. Everyone is different. Now there is some finding behind possibly hereditary or genetic combination where children may have more susceptibility because of hereditary functions, but environmental definitely plays a high factor.
Yeah.
Right. I want to touch up on mental retardation.
Okay.
We have so many things, Down syndrome, all these developmental disabilities, right? And sometimes I'm curious to see what specifically separates them, and are they cousins of each other?
You know,
Is that a tough question?
Well, I think she should be the first one to answer that.
I think that
I read here just a fact. Again, I don't know how true this stuff is, but 70% of children who have mental retardation also have autism.
you know, I think that how you even define these different elements, right? What the stigma attaches, what these different things mean. You know, you catch me on a Sunday afternoon, my IQ is going to be a whole lot different than a Monday morning, right?
That's a great point. That's a great point.
All of these kids have to take neuropsychs. So it's testing by psychologists. They all have to have them like every 3 to 5 years. So depending upon where the kid scores, they are whatever level. Mildly, moderately, profoundly, whatever it is, normal or typical or whatever it is. Now, in the beginning, really when you take IQ tests, my daughter's like on the other end, like really smart. Your IQ test really should never change, okay?
Sure.
It shouldn't.
Right.
Your percentile.
Yeah.
My son's has moved up.
Really fascinating.
Like a lot.
Why do you think that is?
Because he continues to grow.
And neuroplasticity is a real thing.
Normal. I'm not saying it's normal.
But it is real, and people need to talk about the fact the brain changes. It is a muscle,
and
worked out.
I'm so grateful that it is.
Yes.
And Amanda has sat in with the during 1 or 2 of the neuropsychs, and even the psychologist said she's was shocked, like at the difference one year of
and you learn
3 years.
Are there misdiagnoses sometimes where they might misdiagnose somebody who has?
He could participate more in the test
because a child develops differently.
Exactly.
And because you have provided support along the way, the therapeutic services, teaching him skills is how to attend now, where he probably couldn't attend when he was 4.
No, this was like 10. This was like 12 to 15.
They grow between 12 to 15.
But so what I would say to you, Tom, in the end is those tests are most of the time totally meaningless for this population.
Well, and another thing is too, is if you're talking about looking at a pool of individuals who have been diagnosed with mental retardation, for whatever we kind of define, if you're just even looking at that IQ component, right? But then to go and say that X amount of people with this disorder have...
By the way, they did say, however, most people with autism are not mentally retarded.
You see, I think that those are very vague statistics, and I think that if you go and you look, mental retardation can take place from traumatic brain injury. That can take place from deoxygenation at birth. That could take place from a slew of disorders. And really, to be able to then take a pool of people with MR challenges and their functionality or the lack of ability for someone to actually give a proper IQ test in the right setting, and then look at autism, which is kind of, you know, this very large pool of individuals and symptoms and how it looks, I don't see how you could put a direct correlation or purpose to that, other than the fact that if you have a child who's not able to perform certain tasks when presented with them, that's going to be what the Board of Ed looks at, and whether or not they're going to fund a certain type of school. That's going to be what health insurance companies are looking at and deciding whether or not they're going to approve more therapies. That's what these state-funded programs, like from the Office of People with Developmental Disabilities, are going to look at and say, oh, do you have it bad enough to be able to get these services? And that is another component of when you look at the diagnoses and the needs of different individuals.
Well, we touched up on that a little bit. We're going to get to it as far as how much does government help out, right? I want to talk a little bit about sexuality. The one thing about sexuality, not just the sex, but the gender part, is that males outnumber females by 4 to 1?
In being diagnosed with autism, yes.
Why do you think that is? That's fascinating.
I think a lot of girls present more mature and sophisticated and are underlooked. I think that also, though, boys in
so you think that it might be higher, but it's just overlooked?
I think that that's a component, but I also think that there are just, boys have a different developmental trajectory in neurotypical children as well. And I think that the area of the brain already is kind of aligned differently in men and women.
So the 4 to 1 thing is...
it's definitely more prevalent. It's more prevalent in boys. It really is.
It's more visible.
But I think that women need to be more represented in this as well. And our schools are starting to show that, because women kind of have throughout time always had to rise to the occasion, and so they're just meant to figure it out and deal with the social needs.
Oscar, do you go to functions or parties with other autistic people?
I do.
You do.
I go to all sorts of events.
Do you find that it's a even blend of male, female?
Yeah, I network.
Yep.
How many boys versus how many girls?
A bunch of boys and a bunch of girls.
Right. Do you think there's more boys than girls?
Yeah, more.
Or there's more girls than boys?
Both.
Both. Okay, so more boys than girls?
Yep.
Okay.
Depends on the event, I guess. Yeah.
Right, depends on the event, sure.
One of the things that I saw when I became a father was all my children were born premature. And the boys had more challenges than the girl did. And I think I go along with the idea, and even some of the students that I see, the boys struggle mightily between ages 6, 7, 8. I would say anywhere from 6 to 12.
Right.
That they really, really do struggle in learning capacity, taking in ideas, things of that nature.
Right.
Where girls that I've tutored who are 6 to 12
Why do you think that is? Is it just emotional maturity?
Probably. I think that maybe developmental-wise, I think they're ahead of it for whatever reason there is. Eventually, at some point in time, they do catch up. I mean, I've seen it with high school students where they're 15, 16 years old, both are at the same point.
Sure.
But it's going through childhood where, like we're talking about different parts in here. Not everything fits all here.
It's true.
Oscar, when you go to these, do you have a girlfriend or no?
No.
No. Do you like to find one?
I don't think I need to be single and networking with all these people, but I'm matched with my buddy Alessandra.
You have a female friend, Alessandra.
Who's a buddy from Best Buddies, who I've been matched with.
What do you mean matched? Matched in what way?
Paired up, actually. From Best Buddies.
Oh, is that an organization?
It's an organization that supports, Oscar and a lot of people on the spectrum. I have not, but the context is not in a dating context. The context is really more in having someone to help you facilitate different circumstances and social events.
Sure. Well, when I met with Oscar, he said something interesting, which I want to pull out now. So, but Oscar, I get the sense that you don't want to ever be in a relationship.
No, I don't think
you want to.
But probably not for a while, actually.
Right, but what's the delay? In other words, you're 23. Why?
It's hard to find someone with the issue.
Sure, that's a big problem. So the question I was when you go to these functions and there's a lot of autistic people there, because you're outnumbered, where there's more guys than there girls, right? So it's tough to find somebody. Is that the case as well?
Yeah, that's what it is.
Right, right. So when you hang out with Alessandra, do you ever feel a spark?
I like her a lot. She's very warm, actually. She's gun-ho, as my mother says.
Do you find her physically attractive?
Yeah, I do. I feel like she's gun-ho, actually.
Right.
She's very warm. I really like her a lot, actually. I told her.
You said something interesting, though. But you do want to have a relationship at some point.
At some point, yeah.
Right.
Like,
will that include having a sexual relationship?
Yes, I don't know when, but somewhere down the road.
Right. You're not against it, though, right? You're not against having a sexual relationship with someone.
No.
Right. Jennifer, you're making faces. Everything okay?
Not at all.
All right, good.
I'm like,
no, because he mentioned something interesting I wanted to touch up on. Because, Oscar, when I asked you if you had sex, you said, I'm Jewish, I don't have sex. Now, Amanda, you're Jewish as well, right? Do you have sex?
I do.
But my question was, you asked about him having another autistic girl. Like, he can also have someone that's not autistic. So he can go to Shake Shack and there might be a girl that may have the ability to have the patience or connect with him on a different level.
Yes.
Or they may have something in common that they
Agreed.
both can just speak about.
How common is that, though?
It is
happens.
common, absolutely.
It happens.
Yes. There are more and more dating
as
sites.
friends,
and
but relationship as well?
in a sexual context, in a marriage context, in a friendship context, there are blendings.
I'm not slamming that.
No, not at all.
I'm just trying to be realistic.
No, but it's
And I'm
important for
giving
you
you
to
the
have
reality.
the information.
Yeah, just
so that you
it's
know.
realistic as to how prevalent is that?
It happens.
happens.
Because you don't know, I'm trying to help you to understand.
Sure, absolutely.
So, of course, you're going to assume an autistic person will blend well with another autistic person. That probably is not highly unlikely because they're both autistic.
Of course.
That's true, where they
So
have
they
push
both
the-
have social quirks. So they may either attract to each other because their quirks are so similar that it attracts, or they may need someone that actually brings out the fact that they have something in common and can speak more about it. You'll see more shows now portray someone with autistic and the other partner is typically developing.
What are these shows? I've never seen them.
They're
on some of the
You mean
TV,
like
the
regular
regular
network
television
shows?
And the other thing is too is now we
Right,
have
but
to
that's a
represent
minor
the,
part of it, though. That's not a big. That's not a. In other words, when you say you see shows, it's not prevalent all over, is it?
It's emerging.
It's emerging. Well, emerging is more realistic than being prevalent.
But I think what Dr. Ali is saying is the truth in regards to actually the real life experiences that we come across in different interactions with people, and the autism community itself, or the autistic population of young adults going out and speaking for themselves and saying, and there are dating sites that are created by the autistic community that are not just saying, hey, if you have autism and you want to meet up, hook up, let's have a no strings attached
Which
little
is a
moment.
wonderful way
They're
of
not
promoting.
stuck on that. But hold on one second, though. The other thing is that they are saying if you're sensitive enough to handle us and our world, anybody, it can be a part of that so long as they're aware. And that is saying neurotypical, you're cool with us if you're cool with us. And you want to date me? All right. But then you need to know what that is.
Well, let's ask Oscar. Oscar, do you go on any of these dating sites?
I don't, but I like meeting new people for get together.
Would you go on a dating site?
I would one of these days.
Well, one of these days, I'm trying to understand what the delay is. Why the holdup?
It's hard to find someone.
Right, but if you go on a dating site, though, in other words, you're open to going on a dating site. Have you had experiences with other? In other words, were there people that you were interested in that weren't autistic?
Yeah, I've met so many people who are autistic.
Right. And do you think that there could have been a spark between?
There could have been.
There could have been, right. Oscar, you and I had a conversation about you being Jewish and not having sex.
Yes.
What I'd like to know is, how did that formulate in your mind? How did you come to the conclusion that because you're Jewish you can't have sex?
Because I was born and raised Jewish.
Right, but Amanda's born and raised Jewish as well. And in other words, what I'm trying to tell Oscar is that just because you're Jewish doesn't mean you can't have sex. In other words, what I'm trying to say to you is that
I think that how maybe some components of who to meet or how the interpersonal elements of how he was raised and what those discussions were, maybe that's something specific to just how he associates those things. I don't think that there's really a causality or a generalization relating to his sense of religion.
Right.
I think that that's also one of those things where sometimes the
mainly
conversation.
what you're saying is that, well, because I'm trying to get to the bottom of how he came up with the conclusion.
I think, but that might have been a language-based kind of association in the moment. That if you broke it down and say, "Do you think that Jewish people can have sex?" I don't think that Oscar would. You should ask Oscar.
No,
I don't want to speak
for him. Oscar, I asked you about your kind of delved into your sexual lifestyle. I guess I was just curious, and then you kind of. It seemed to me that you kind of put the kibosh on it right away. You didn't even. I got the sense that you didn't want to talk about it. It was uncomfortable for you. Is that the case?
Yeah, I just don't like talking about my
Is this conversation making you uncomfortable?
No, it isn't.
It is?
It's not.
It's not. Okay, good. If you are, just let me know.
I will.
Okay,
don't you worry.
Because I think it's important that we touch up on this because I think on some level Oscar might be a little misinformed.
Well, I think parents raise their child the way they know or the way they think it should be. And if he's brought up in a household where they may speak about when it's okay, when it's not okay, it depends on how the conversation is occurring in the house. Now, he may have his...
And I don't want to malign Oscar's parents because I've never met your parents, so I don't know anything about them, right? But I do think that whether a parent has a child of autism or not, these are things that need to be discussed regardless.
But the other thing is that you can look at sexuality and fluidity and gender and all of these different elements, right? And that's whether you're talking about the autistic population or not, right? Something that is so inherently private and unique and different. And there is actually some studies out there actually within the autistic community about how many individuals are either asexual or not even introduced. I couldn't quote those directly, but they're out there.
A lot.
Again, I don't want to misspeak, but it's prevalent.
It's prevalent,
right? Okay. And then at the same time, when you just have people not talking to people about life and sex and dating because they've had so much of an uphill battle and so many other things to work on, nobody has sat down. Oftentimes, people have not addressed these things, and now adult programs, residential programs are starting to come up with sex ed classes for the special needs community so that they can go into it with knowledge, whether it be self-love or love with others, how to protect themselves, how to advocate for themselves.
Well, you mentioned, Dr. Ali, something interesting with me that really kind of took me for a loop.
Go for it.
When you deal with these kids, there were times when it was one-on-one with you and they reached in and they started to pleasure themselves?
Well, what happens is they're children, right?
Right.
And because...
What age are we talking about?
We are talking about from teenage age. It's always teenagers.
No, but specifically the kid that was pleasuring himself.
It wasn't, I wouldn't say he got to the point of full pleasure self, but I would say that he put his hand down his pants. And we still, as autism parents and individuals that work with autism, we're still teaching appropriate touch, what's okay and what's not okay. So sometimes they will just walk into the room and they will put their hands in their pants. However, I do believe at that time that there was an attraction to me and that they did put their hands down their pants. So now it's up for the
there was an attraction to you?
Absolutely.
Yeah,
I mean, I would think so.
Have you seen her?
I'm kidding, but no, there was attraction.
Very attractive gal, but I just
no, there was
wasn't. I didn't hear. That's right.
No, there was an attraction. Because I knew, they said from before, and I know when a child, they like you and then they're giddy about you. That's what happens to most teenagers. I have it with my toddlers when I work with them.
Oscar, what are your thoughts? I mean, you never had an experience like that, did you? When you were working with somebody, a doctor or something, and you did that? No,
did what?
Inappropriate
you reached
touch.
down and no, God forbid. But Are you in touch with your sexuality at all? Is it okay if I ask that? Or no?
I mean, I don't know. Are you going to ask the rest of the panel?
No, I'm asking
then
him
I don't know that you should necessarily, if you're not going to ask them all. I think, would any of us, would you put your hands down your pants in a social situation?
No, because I know better, but here's the deal.
There's a lot of people on the subway who are neurotypical who don't.
Yeah, but those are
It's New York.
not too many. There's not too many there. You're talking about the creeps in New York.
There's a lot.
but there's not as many there. But, well, you never know. There might be, but they don't act on it. Okay, granted. No, but I'm specifically asking Oscar because we're dealing with how educated people are. I think that's...
but asking whether or not somebody masturbates in their own private life or if they would do it in a classroom isn't something that I would think you would go and just ask anybody.
Well, I'm tying it in, yeah, but I'm tying it in with the fact that he says he's Jewish and he doesn't have sex, and he sort of...
But I think... I'm being concise, so I'm going to for a second and let that kind of maneuver.
Ask Oscar
okay, so Amanda, so we should move on?
I personally, I would, but I'm open to what you need
all right,
to
let's
do for the
move
show.
on.
Well, what do you want to know? What are you curious about? Ask the question, and with our experience, we may be able to help you.
Let's
and
move
he
on.
can answer.
Let's move on. I think we touched up enough. Look, I think many people want to know about the sex life of autistic.
But we could talk about that.
Of autistic
You want to
people.
talk about sex? I don't think we have to talk about individual
Well, why
panel
not ask
members.
somebody who's autistic,
but ask him about people with autism, not necessarily just his own. That's
Does he
all I'm
know?
saying.
I don't think he knows. Do you know? Do you know about other people and their sexual?
Do your friends at the Best Buddies or at other places talk about
Like
their
when you get
girlfriends or
together with
boyfriends?
Alessandra, do you talk about sex?
Yeah, she has her boyfriend Joey. I met her boyfriend Joey.
Oh, I see,
And then
okay.
a friend of theirs named John. We all had dinner. And we went for Mexican food.
Right.
Well, I'm assuming if she has a boyfriend, Alessandra's not going to sit there and talk explicitly about what she does with her boyfriend.
But not everybody talks about as open in their sexuality. How
Sure
you
they
and
do.
I
What,
might
girls
sit,
get together and they talk about with the guy they were with,
but you
and
know
guys
how many
get sure,
people who I
absolutely.
say, in my staff circumstances, some people might sit there and say, yeah, you know what, when I got laid, I had a great time, blah, blah, blah. Let's get into all the nitty gritty. And then you
Right.
go to somebody else and they say, my private life is my private
Yes,
life, and I'm
agreed.
not comfortable sharing that.
Agreed.
And you know what, for other purposes, maybe they're saving themselves for marriage.
Sure.
Maybe they've had unfortunate circumstances and they're not comfortable talking about that at all, and they don't want to be seen as sexual, whether they're autistic or not.
Agreed. Well said. Okay.
Thank you.
I agree with you. So
Love you, Tom.
I love you too, baby. I get the sense, and we touched up on a little bit with bad parenting. Just like with any bad parent, whether it's a child, autistic
Well, what is
child.
bad parenting?
Okay, let's define bad parenting. To me, bad parenting would be neglect.
Mm-hmm.
And neglect has to do with also not informing, educating. Right?
About sex?
So that's what's that?
Would it be about sex? If they don't speak about sex, would you consider that bad parenting?
Yes.
Even if it's without and not
I
a
think
part
so.
of the cultural dynamic.
I think it's, yeah, well, look, whether you have a child of autism or not, if you don't talk to your son or your daughter, communication, if you cut communication off, it's bad parenting on a general note.
So that's a general term.
I think a parent with a special needs child, whether it be autism, whether it be Down syndrome or anything like that, this is a very, very stressful situation for a parent. All parents take a very good interest or a special interest within their child. If they're bad parents, then they shouldn't be parents. But you have parents that are special needs parents.
Unfortunately, they became parents.
It's a situation where you're in a room here with people who have special needs children, and it's very difficult to go through the times and days that are not very, very good times and days,
Right.
and you have to be very, very patient. You have to be you have to step up being a parent to another different level that a lot of other parents don't have to be.
Right.
And it becomes you're watching your child deal with frustration in ways that other children might not have that problem. And so you have to become very, very involved with your child to the point where...
But you're just talking about general parenting. You guys went through it, and it's a little bit harder, right?
Yeah, because you have extra circumstances that you're dealing with.
Right.
Because you're dealing with not the lack of communication. And the communication is not the fact that I can't communicate. It's
Right.
the fact that how do I communicate
That's
to
right.
a person
Right.
whose cognitive level may not be at the place where they're fully understanding everything.
Right. So you as a parent, you have to figure out a whole new way of going about it.
And you need and I'm lucky because I'm a speech language pathologist and I have the ability to communicate. So I've learned strategies and how to explain it simple. This is why we have educating classes. This is why we're now letting parents know you don't have to do this alone. Like, get some help to try and do this, or else what's going to happen? Their child is having moments where they want to do things to themselves or they want to have pleasure, and because they're busy hiding it or the parent doesn't know how to deal with it, you're dealing with behavioral breakdowns because they're frustrated because they can't release. So now we have so many other dynamics.
Well, I saw it in my own son, where my son was 2, 3, 4, 5. By the time he was 6 years old, frustration of watching other children do things turned into anger.
Right.
So coming in home, having a bad day in school, you'd say, how was your day? Not get an answer. 8 o'clock, maybe 9 o'clock, time to go to bed, pick up a chair in the kitchen and throw it against the wall.
Right. And that fares very badly for the autistic,
and then what happens,
for any kid.
And then what happens is that parents of special needs children become targets.
Yes.
We become targets in the DOE. We become targets in public, because the assumption is that you're child abusing this child, and that's the reason why the child is acting this way. That brings in the state and the city.
Right.
You have enough trouble as it is with trying. There's no manual to this child that you have, and we'll even go. That we're talking about. Okay, so this is as a parent-wise, but think about that as a teacher, and you're teaching a child like this, and the child is acting out. Now you cannot address a child outside the way you would your own child, but there are assumptions that the public makes against you by having this child. Oh, that child is behaving that way. You should really smack that child.
Right.
And so there's a culture that parents have to deal with involved in this. I don't know how to
More than anybody else.
More
You're
than anything
100%
else.
right.
On a general note, if you're a parent and you don't teach your kid some sensitivity, and you teach them not to be a bully, right? Because when I see bullies, automatically I think bad parenting. Not all the time,
Right.
But
Or
it's fair to
cycles of
say.
abuse that are kind of transcending
or that as well,
moving
but that's
forward.
bad parenting, right?
Right.
And I can only imagine how much more amplified that would be for a parent to go about doing the right things if you are a parent of an autistic child.
When you say go about the right things, what do you mean? So I can be a little clear in how I answer.
The right things are based on what any parent should do. However, though, aren't you forced in this world where things are just amplified? Everything is accelerated. There's always the energy going, with an autistic child, right?
Because it's different.
It's a different energy.
It's unexpected.
So that feeds onto your energy, doesn't it? Doesn't it sort of zap you on some level?
The fact that you have a child that their behavior is unexpected, you're not quite sure what's going to come out of their mouth.
Sure.
And you have to work on yourself first
You have to have a game
before
plan.
even knowing how
That's
to
a
help
great
them.
point. That's an
So
excellent
if
point.
you are so easily agitated, or you're having a rough day at work, and you're now dealing with a child with they're having their own breakdown in communication and behaviors are showing. Here you have a situation where it's just, how do you bring Zen back into this room?
Well, what I was just going to say is part of what Dr. Ali does with her work, and what so many parents don't realize, and what you could define as bad parenting, it really also comes from people are sleep deprived, they're exhausted, they are not being given all the right information and shared. The financial drain is so challenging. Relationships with partners, their husbands or wives or lovers and families disappear, friendships disappear, and there's a whole other question of the support of the parents, because they're not given the same basic foundation things that other parents are.
Well,
and that affects how they move forward with their children as well.
I assume on a general note, generally we could say that, the personality or the character of a parent, since they were a child, their DNA,
Autism changes everything.
No, that's right. That's what I'm saying.
And there is no
I'm just saying,
manual.
there is a foundation. In other words, Dr. Ali, you strike me as a sort of a stable force in your son's life, right? We discussed, you said something interesting. I think you were at a party or something, or some kind of function, and your son took it upon himself to goof on another kid?
Oh, yes. So I was speaking about when we went to a program that he goes to, and he saw a child that had secondary characteristics of twirling and making flickering movements.
Right.
And my son went, and I said, Zachary, what is that? And he says, they're acting weird. They're doing things with their hands. But he will also say that if he sees someone in their eye, they have a lazy eye, he'll go, what's wrong with your eye?
Right, no filter.
Because there is no filter to this game. What they see is what they think is what they're going to see. So now it's up to us to help them to understand that this is how Johnny shows that he's having fun. Now you'll jump up and down, and that's how you show, and this is how Johnny shows he's having fun, and for him to understand that. So it happens with all of our kids. It's just that we have to, as parents, help them through the process by communicating, helping them to know what's okay and what's not okay. But some parents do not have that ability. They're not aware of how to do this.
Oscar, did you hear what Dr. Ali said?
Yes.
So we're kind of talking about people that are in various places of the spectrum, right?
Yes.
And some might be a little bit more severe, than others. And so have you been in situations where people have made fun of you, other autistic people, or no?
Yeah, like, for example, when I used to go to Rampark, one of this camper pulled Darren's glasses and told my bunk lead Matt to tie his sunglasses. They took me away, and there was this other camper, Jake Grimm, the GRTC. He pulled Brianna Morales' hair, so they took me away, actually.
But that's not necessarily, that's just typical children being...
I don't know enough.
Well, bullying happens everywhere.
It does, unfortunately.
Bullying happens everywhere. Bullying even happens between autistic and autistic child. Bullying happens. It's just a different form, and we help them to work through the process the same
Oscar,
way.
I had a conversation with you, and you have a brother, right?
Yeah, I have a brother.
Okay, you're 23,
Yeah, he's
and your
18.
brother's 18, right? And your brother is younger than you, but you guys still don't talk?
We don't talk.
And you haven't spoken in a long time,
yes.
right? And you told me why. You want to tell us why you don't talk to your brother?
We don't get along.
You don't get along, right. But when you guys were younger...
we got along then, but now it's older. We don't see each other.
At what age did you get along? When you were 5 or 10, you got along?
When I was 5 and he was 10.
Well, no, well, he's younger, but you told me that you were, at times, you used to goof on him a little bit, right? You used to tease him?
Yeah, I do, but I don't do that anymore.
No, of course not. That's because you learned it's not the right thing to do, right?
Yes.
Right, so you recognize that it was wrong, right?
Yes.
Why don't you guys talk anymore then?
Sure, one of these days, but probably not for a while.
Sure.
Right?
Don't you feel the urge? In other words, did you recognize that you did something wrong, and
Yeah, that was when I was younger. That was a while back.
Sure, I understand. And you don't tease any other kids for being autistic, right? Let's say your brother wanted to repair the relationship. Would you want to?
Yeah, one of these is probably not.
But is it more him that doesn't want it? Because I got the sense that it's more him.
More him he doesn't want.
That he doesn't want to repair the relationship.
Yeah.
And is it understandable why?
No.
No. I get the sense, I don't know, I never met your brother, but maybe he feels like you teased him one too many times, and he still harbors anger.
That's what it is.
That's what it is, right.
Would you like to one day have a better relationship with your brother?
Yeah, one day, but not for a while.
He wants to, yeah.
If you learn certain tools, or if you learn certain ways of how you can get your relationship closer, not necessarily like this, but just a little closer.
Yeah.
Would you
Baby
like
steps.
that?
Yeah, but not for a while.
Okay.
Not for
Everyone
a while.
needs their space and their time to process.
Everybody, they have to do it at the right time, whenever they're ready.
If it's going to actually bear results, it's a big risk. It's a hard thing. I have fascinating sibling dynamics, and I can relate to how much time goes in between trying to fix those things sometimes. And when you're trying to focus on yourself and all your own things in your life, and Oscar has a very full life, you don't always want to kind of have it to take on a new project until you're really ready.
Yeah, and especially meeting all these new agencies.
Right.
According to a study, U.S. study of 1,400 kids with autism found that half were aggressive or violent towards their families. And so, Oscar, was there, when you were, so this was, I remember the New York Times article came out back in 2004. When you were a child, did you have aggression as well?
Yeah, Amanda, I told you when you and I met.
You did, honey, you did.
So my father's coming out of the hospital from stomach surgery. I had a maple syrup in my shirt the first time that happened, and my mother, Vivian Duquette, said, please tell the teacher to the matron to put a shirt in Oscar's backpack, and then the bus took off, and my mother got a call a few minutes later saying the bus from the company, the OPT, Office People Transportation, the bus is returning back because your sons bit the matron, hit the driver, and another kid. Then 3 police cars showed up in an ambulance. And the fire department, this woman cop asked, why did you call? And then the article ran on December 4th. And a week later, they did this to us again and brought an ambulance. And this woman cop called this officer so-and-so with your son in an ambulance. Your son's...
But you told me that you were basically, the bus driver was a little bit...
not nice.
Not nice, right. And so as a result, you kind of lashed out, which is normal, right? Because if anybody's not nice, I mean, it's not normal to physically attack somebody, right. But we lash out, whether it's verbally or, you know,
we all have our ways of letting loose, right.
Was the bus driver fired?
Yeah, he was not being nice, and...
Did you ever see him ever again? Never again.
And the article ran December 4th, and they did this again a week later, brought the police, and I was taken in an ambulance. And this woman cop called my mother and asked, said, this officer so-and-so with your son in an ambulance. He's just bit the matron and hit the driver. Another kid, we're taking him for a psych test. Really, he's minor.
Oscar, when you were a young kid home, everything was kind of, do you have a calm family life? Calm family life.
Yeah, it's just hard with the school bus. It doesn't happen that often.
Right. So your parents were always calm, and there was always a sense of calm around.
Yeah.
Sure. And I saw this BBC video, and it's kind of heartbreaking because, you know, some of the quotes from a parent, permanent state of worry. You know, wake up day in, day out. They're always in this state where they have to wake up, and every day is, you don't know what's going to happen, if you're going to get striked. I saw videos and pictures of parents with eye gougings. How do you reconcile? I mean, have you dealt with parents that have had to literally put their child away?
Yes. I deal with it a lot as a parent coach.
And the sense of guilt.
It's the thing about it is their child has a breakdown in communication.
Yeah.
So because they cannot communicate, it shows up as behavior. Because the parent does not know how to respond to this behavior.
Right.
Then you'll have either a very aggressive situation where the child is trying to just lash out, and they could care less who is the person that's receiving it.
Sure.
Because it's just a behavioral response. The parents, on the other hand, may have to either call the cops or learn certain strategies as crisis intervention of how to handle this child.
What do you hear from parents when you talk to parents and they have to give their child away? There must be a lot of crying involved.
They would keep their child home and have their child hit them or beat them.
Definitely experienced split lips, bruising all over. He's knocked me down the stairs before, and I've just managed to hang on to the banister rail so that I've not gone the whole way down the stairs.
They cannot take anymore, and even as they have to release that child, it's one of the most painful things because they go back through guilt.
But yeah, guilt plays a massive part of every day.
Denial, anger, the same bit before they can realize, oh, wait a minute, I had to do this. I've just became certified in the program now where we can help teach the parents how to defend and handle the situation with care.
What do you do? You have to teach them?
We teach them verbal strategies, and then we teach them physical strategies of how to retain the situation where they can still be within safe. Well, it's still a process.
Right. Jennifer, I was going to ask, you never had an issue with your son?
No. Thank God.
Yeah.
What is the relationship like with those children? Do you have any clients that you've worked with long enough?
Well, once they get into the separate location, the child usually is on high psych medication.
I have found that therapeutically, it's not always a matter of psychotropic medication that is used as the strategy, but the separation and the opportunity for people round the clock to offer therapy to the child and then mediate and support with the family. There are healthy ways to do it, and it's not a giveaway so much as it is an opportunity for everybody to recollect and then learn how to be able to move forward, and it can be a very healing process.
Jennifer, we touched up on this. So basically, some of the parents, they're writing for help. writing to the government to help out. One woman said she's desperate for help. It could be a tremendous financial responsibility. Are there programs now, particularly in New York, that help people with parents that are needed?
If you're under 21...
What do you mean, the parent or the child?
The child. The child's under 21.
Yeah.
You can get help with schooling and therapies through, especially if you're in New York City, with suing the Department of Education. You can also get Medicaid through agencies and things like that. We've done the Department of Education. Our son has been in a school and we've gotten therapies for many, many years. Then when you're 21, you can get, or 18, you can get Social Security help and help for, when they're 21 on.
What role does music play? It must be a tremendously satisfying thing for autistic and music, right? So how do autistic people relate to music?
The brain is so wired for where language can be such a challenge. Another part of the brain is affected by music, right? Sure. It's universal, it brings joy, it brings connectivity. Most people, when they're listening to music, get to move, so they get a sensory experience.
Jennifer, did you turn your son on to music?
He likes music. He's not the biggest music person.
Right. Have you noticed a shift with him when he listens to music?
He's done a lot of music programming, especially to him. He's not what Amanda's talking about, really.
I also noticed horses.
Oh, he's done that. Yeah,
really
huge.
And autistic people really take to horses, and the first thought that I had in my mind is that there is, you're on another animal, and there's a sense of trust between you and the horse.
It's true. It's also
sensory input.
In many cases, maybe they might not have trust in humans as much as they do on a horse because they get on a horse. And look at this, the horse is taking me to where I want to go.
It's a type of therapy. It's called hippotherapy.
And your son really took to that?
Yes, he's great. Well, he can ride independently, but it's called hippotherapy, and they get all this great input.
It's that proprioceptive input, too, the shocks going through their system. It's very grounding and organizing.
Sure.
Meanwhile, my son loves swimming, so
He used to love
aquatherapy.
swimming,
So
too.
autism is a spectrum. While some may like music, it may hurt their ears, and they're totally not into it. They don't vibe with it. So there are so many different types of therapy that will help a child. So when one doesn't work, a parent needs to just try a different one.
Right.
And not think that all autistic children are supposed to like music or supposed to like horses. My son doesn't really like horses.
Have you guys heard of something called Minecraft?
Yes.
Okay. So there's this guy by the name of Stuart Duncan. You know about this guy? Anybody know about this guy?
Minecraft the game, you mean?
Well, he started a Facebook page, and it's just all for autistic kids, and he really created this really wonderful community where the kids feel like there's a safe place. And they go there and they play. Do you go on Minecraft? Do you know what I'm talking about, Oscar?
No.
No. You should look into it. But I just, reading about this guy, and he did a TED Talk, and also autistic himself. So basically his name is Stuart Duncan. Duncan has Asperger's syndrome. He got a serve for $2.50 and started his own page on Facebook, and I'm not sure exactly how this stuff works. And quickly it exploded, got 750 emails in the first 2 days because there was such a need for a place like this.
They would tell these kids, some as young as 6 years old, that society doesn't want them and their own parents never wanted a broken child, so they should just kill themselves.
He created the community.
Well, and
He created a community. And what a wonderful community to create. And I really applaud this guy, Stuart Duncan. Quote from Stuart Duncan, these parents, they really, really felt they had no place to go, and here was a place where they thought, my kid won't be bullied.
I saw parents on social media reaching out to other parents asking if their autistic children could play together. And the reason is that when they tried to play on public servers, they kept running into bullies and trolls.
And he says, I didn't have to do any ads.
Within 48 hours, I got 750 emails. I don't have that many Facebook friends.
He says they were just desperate to find a place like this.
That's great.
Just some other things I highlight. He says, when you have a lot of insecurities, face-to-face communication can be very limiting.
Yes, that's what I was thinking.
So this is all cool too because it's done online.
Yeah.
I started hearing from parents who said that their nonverbal children were starting to speak.
Whereas in Minecraft, you don't feel like you're talking to a human being, but you have fun and let your guard down.
Yes.
And so if you just look at what's going on, you okay, Oscar?
Yeah.
Okay. You want to add
Time
anything?
is of the essence, right?
You want to add anything to what I said?
Well, can you repeat that?
Well, it's just a community online, and they play Minecraft. I don't know how to play Minecraft, some kind of video game.
Not my thing, you know.
Do you play Minecraft?
There you go.
Oh, it's
But
not
what
your
is
thing.
your thing?
It's just
Doesn't have to be. Okay, sure. But we're just basically talking about how this community of autistic people have been created online, and they go there and they interact with each other, and it's a safe place and a good place to be.
Got it.
Some of the things that have happened as a byproduct of this place, right? We saw his reading improve, and we saw him become more and more willing to chat with other players and carry on conversations. This is a child who went on. Something that was very hard for him originally. We also watched him build relationships with certain players. There's one player in particular that he loves to play with and asks about often. Now, and they say for their son, that's a huge deal.
Right. Great.
Never happened. To me, when I read about this stuff, I realize that there should be more people like him and more people like you guys that are really in tune with the sensitivities of autism, because I think this is a big deal. That to be patient, right? Right, because isn't patience a big deal with autism? Huge.
Parenting in general, I would think.
Well, parenting in general, but we're talking about autism. So,
Right,
so specifically is a huge thing. And basically, a quote here that I blew up.
The children on my server are not afraid. They are free to just be themselves. And it's because we support and encourage and celebrate each other. We all know what it feels like to be the outcast and to be hated simply for existing. And so when we're together on the server, we're not afraid anymore.
Anything you want to conclude with?
What I would just say is it's amazing, and the conversations have to keep on going. And this is just the beginning of getting people comfortable with what else there is to figure out, you know.
Dr. Ali?
Communication is the key, finding a commonality and creating a place where they can go and they can feel welcome and be themselves.
Jennifer?
Parents have to be patient and advocate really hard.
Right. Bob?
You have to be involved in education and development.
Right. Oscar, you get the last word.
Fun.
All I ask of you is for you to prove these words are true. You better learn to show consideration. All I ask of you is to listen to my point of view. You better learn to show consideration. You should have learned to show consideration.